Okay, definitely one question is going to come in the June exam from joints. So joints and their examples, you have to remember that one, sir. Now, why I have included this question here is that it has been the same question has been repeated in the last two exams. So last year, like 2021, in the June exam as well as in the December exam, this same question was repeated with the same diagram also, picture also. That is a radiological image of all your tarsal bones given there. And in tarsal bones, yes, the bone which is marked there in front of talus. This big heel bone here is actually the calcaneus, guys. Above that there is talus here, or talus ke samne, in front of that, this one will be the navicular. So God knows, they might again repeat, or they can ask you about any other bone there, guys. है ना? So that is the reason why in our classes, in our videos and DocTutorial already have made the student even draw the diagram for tarsal bones. So you will be able to easily identify that is navicular in front of talus. Next one, the nerve involved in a difficulty in eversion of the foot and loss of sensation in the dorsal aspect of the foot, guys. Okay, fine. If you people have attended my classes anywhere, guys, whether it is on our DocTutorials platform or in the live face-to-face class, अगर आपने attend किया है, तो I hope you all remember my golden rule about the 5 major nerves in the upper limb and about the 5 major nerves in the lower limb. So in the lower limb, like the 5 major nerves, whatever 5 major nerves that you have, they'll be supplying to all the compartments in thigh, leg and the foot. Now, when it comes to the lateral compartment of the leg, in the lateral compartment of the leg, you'll be having 2 muscles. One is the peroneus longus, another one is peroneus brevis. In the lateral compartment of the leg, you'll be having like 2 muscles. One is peroneus longus and peroneus brevis. And these 2 muscles, they are actually supplied by superficial peroneal nerve. Superficial peroneal nerve, it is the nerve of the lateral compartment. The superficial peroneal nerve is supplying to lateral compartment. And these 2 muscles, when they're going to contract, what is going to happen? Suppose if this is our foot, the right foot and the left foot. The right and the left foot, they'll be having a medial border here, and this will be the lateral border here. Elevation of the lateral border. If you elevate the lateral border, that is known as what? Eversion of the foot. When you elevate the lateral border, that is known as eversion of the foot. And eversion of the foot is done by the muscles present in the lateral compartment. Okay, fine. And then apart from that, yes, in the other diagram that I have shown you here, all this which is highlighted here in the green color, this skin here, it is supplied by superficial peroneal nerve. There is nothing but the dorsum of the foot. So dorsum of the foot is supplied by superficial peroneal nerve. And exactly the same thing is given here in this question here, guys. Nerve involved in difficulty in eversion of the foot. The person is not able to do eversion of the foot, sir, and there is a loss of sensation in the dorsal aspect of the foot. So what is the nerve involved? It is the superficial peroneal nerve which is involved here, sir. The superficial peroneal nerve that is involved here, guys. Okay. Now apart from that, your MCI examiner is also interested in the deep peroneal nerve. Why? Because deep peroneal nerve is the one which is supplying to only the skin in the cleft of first toe and second toe, only that skin which is present in the cleft of first toe and second toe. That is the first web space. So deep peroneal nerve is the one which will be supplying to the skin in the cleft of first toe and second toe, sir. That is the first web space. And apart from that, the medial side of the leg and the medial side of the foot, that will be supplied by saphenous nerve, and saphenous nerve will be the branch of your femoral nerve only. And the lateral side of the leg and the lateral side of the foot is supplied by the sural nerve, and sural nerve is a branch of which one, guys? That is your tibial nerve. Okay? So on the medial side, you'll be having the saphenous nerve which will be supplying, and it is a cutaneous branch of femoral nerve, guys. And on the lateral side, you'll be having sural nerve. The sural nerve will be the branch of your tibial nerve. So please remember this one. By this, we actually complete about the sensory supply to your foot there, guys. Sensory supply is also done here. So superficial peroneal nerve will be supplying to peroneus longus and peroneus brevis. That will be actually helping in eversion of the foot. And then the superficial peroneal nerve will be also supplying to the skin covering dorsum of the foot, and deep peroneal nerve will be supplying to the skin in the cleft of first toe and second toe. All this has been already asked in your exam. Please remember that, sir. Next one. Now this is like a recent addition into your MCI. MC exam, like they're asking the questions regarding the thoracic duct. This question, like thoracic duct was not being asked before, like 2-3 years back, nahi pucha jata tha. But nowadays they're asking about the thoracic duct also. So yes, I have also included this in the updated topics for you people in this session. Apart from that, yes, at DocTutorials also, we are actually, I have recorded for the FMGE people, like separately, all the updated topics which are required for the next session, that is your December session, guys. Now, first of all, what you have to remember here is that, okay, what is the structure marked in this image? That is the thoracic duct here. The structure which is marked here is actually the thoracic duct, sir. And thoracic duct is actually going to begin from the cisterna chyli. In the abdomen, you'll be having cisterna chyli. It is acting like a lymphatic heart. All the lymph will be finally connected into the thoracic duct only. There is a cisterna chyli. So now what is going to happen? The thoracic duct is going to cross the diaphragm. So you have to remember, I hope you all remember that very famous topic. Nowadays, all the students are already expert in that one. Okay, diaphragm actually has got like 3 major openings. There are 3 major openings in the diaphragm. So we all remember that very well with the mnemonic as voice of America. Vena cava opening, esophageal opening and aortic opening. Vena cava opening, esophageal opening and aortic opening. And aortic opening is the one from where the thoracic duct is going to pass at the level of T12. So aortic opening se wo pass hota hai, it is going to ascend up. And after ascending up, it's going to deviate towards the left at T4, and then again furthermore ascending up, deviate again towards the left. And finally, if you are able to appreciate in this diagram, it's going to get, yes, draining all the lymph. It is going to, finally drain the lymph at the junction of this left subclavian vein here, and this is the left internal jugular vein here, so guys. So the left jugular vein and the left subclavian vein, at the junction of that, it is finally going to end or drain the lymph over there, guys. Drain the lymph over there. Yes. So remember the structure marked in the image. I repeat all the points that you have to remember about the structure marked in the image there, that is thoracic duct. And thoracic duct, I want you to remember that it is going to actually cross the diaphragm via the aortic opening, then deviate towards the left at T4 and further deviate and finally drain the lymph at the junction of subclavian vein and the internal jugular vein, sir. Subclavian vein and jugular vein, sir. Next one. So all the points regarding that is covered. Now, another important concept about the upper limb topic, which is being tested many a times in your exam, is about the nerves which are actually related to humerus. Now look at this diagram here. In this, the nerve passing behind the mark structure. The mark structure is actually the medial epicondyle here. This is the medial epicondyle. And what is the nerve passing just behind the medial epicondyle? That is your ulnar nerve, sir. Ulnar nerve is the one which is going to pass. By the way, I'm not concerned about only the answer for this question. Let us discuss the entire concept here. How many nerves are in total related to humerus bone, sir? Humerus bone को कितने nerves related होते हैं? There are totally 3 nerves which are related to humerus. There are totally like 3 nerves related to humerus. Okay? And those 3 nerves will be number 1, the axillary nerve, and number 2, the radial nerve, and number 3, the ulnar nerve. So there are 3 nerves related to humerus, the axillary nerve and the radial nerve and the ulnar nerve. And remember, axillary nerve is going to pass behind the surgical neck of humerus. Radial nerve is going to pass in the spiral groove or the radial groove just behind the shaft of the humerus, and ulnar nerve is going to pass behind the medial epicondyle. Ulnar nerve is going to pass behind the medial epicondyle. So axillary nerve is going to pass behind the surgical neck. Radial nerve is going to pass in the radial groove or the spiral groove, and ulnar nerve is going to pass behind the medial epicondyle. So these 3 nerves are very much important, extremely important concept for your MC exam. And next June exam, I'm expecting a question to come from here, sir. One question can definitely come from here also. Okay. Next one, sir. Next concept. A 65-year-old lady presents with a cerebrovascular accident involving inferior frontal gyrus. Which functional area would mostly be affected? So let us see which functional area is present in the inferior frontal gyrus. So let us quickly have a revision of all the Brodmann areas. For example, if this is the cerebral hemisphere, the superolateral surface, And in this cerebral hemisphere, first of all, in the temporal lobe, you'll be having two sulci. If there are two sulci, if there are two depressions there, obviously how many gyri do we have? Like 3 gyri, है ना? If there are two sulci, there'll be like 3 gyri. And you people know very well, like if it is gyrus present there, what is the name of the gyrus? Temporal gyrus. So one will be the superior temporal gyrus, another one will be the middle temporal gyrus, another one will be the inferior temporal gyrus. Exactly the same concept you can also apply in the frontal lobe also, guys, here. In the frontal lobe also we will be having two sulci, so there will be 3 gyrus, but this time the name will be the frontal gyrus. So there will be superior frontal gyrus, and then there will be middle frontal gyrus, and then finally you will be having the inferior frontal gyrus. Now in the superior temporal gyrus, remember you will be having area number 41 and area number 42, sir. That is the primary auditory area. Just behind that you will be having area number 22, auditory association area. But when it comes to inferior frontal gyrus here you'll be actually having the area number 44 and area number 45, that is Broca's speech area. And Broca's speech area, we know very well, it is a motor speech area. Apart from that, you also have the area number 39 and 40 here, which is representing the Wernicke speech area. And Wernicke speech area will be actually the sensory speech area, sir. Wernicke speech area will be sensory speech area. So coming back to our question here, our question is actually about the inferior frontal gyrus. In the inferior frontal gyrus, you'll be actually having what part, sir? You'll be having the Broca speech area. So a lady presents with cerebrovascular accident involving inferior frontal gyrus. Inferior frontal gyrus, what is the area? That is a motor speech area, sir. Which area will be involved here? That is a motor speech area will be involved here, sir. Now apart from that, if you just want to just complete this entire thing, I hope you all know that there is a very prominent sulcus here known as central sulcus. In front of central sulcus, you'll be having area number 4 and area number 6, the primary motor area and premotor area. Behind the central sulcus, area number 321, that is nothing but your 312, that is nothing but the primary somatosensory area. And then finally in the parietal lobe here, you'll be having the area number 5 and area number 7 here, that is the somatosensory association area. And then yes, in the occipital lobe here you'll be having area number 17, 18 and 19, that is the visual area, sir. So you have to remember like 3 things whenever you're learning about the Brodmann speech area, Brodmann areas. Whenever you're learning about the Brodmann areas, remember 3 things, focus on 3 things: the name of the area, the number of the area, and the location of the area. The name, number and location, guys. Name, number and location. Okay. So name is important, number is important, location is important, sir. Okay, fine here.